So acid reflux or gastroesophageal reflux, these are GERD, a lot of people call it, is a condition where acid, which your stomach makes to help you absorb food, it's a normal process of your stomach. It ends up leaving your stomach and going back up into your esophagus. And what it does is it causes that burning sensation because it actually causes inflammation of the lining of the esophagus. Not everybody that has acid reflux needs surgery for it, but what it is that valve, a lot of times that valve that leads in between your stomach and your esophagus has started to weaken or not work as well. It's this collar sling musculature that kind of goes around, and it just over time weakens, and the angle can actually change because some people actually have part of the stomach that come up into their chest. That's what we call a hiatal hernia. Now, not everybody that has acid reflux has a hiatal hernia, but the hiatal hernia itself isn't the problem. It's the fact that it's changed the angle of that valve so that it doesn't work as well. I do quite a bit of testing to try to figure out, one, to make sure that's truly their problem, because there's a lot of other problems that can feel like you have heartburn that aren't necessarily acid reflux related. But two, to see which surgery might be best for you if that's the route you decide to go. There's medical options. There's PPI therapy, proton pump inhibitors like omeprazole or pantoprazole. There's also another medication that's called an H2 blocker that's called Pepcid or famotidine that's sometimes used. And those are great drugs, but the ultimate cure is treating that collar sling musculature to help that thing close off better, to help that flap valve close better so that you don't have acid coming up into your esophagus anymore. And the medications just kind of mask that by decreasing the acid in your stomach. So if we recreate that flap valve with surgery, then we can have a better system that leads to more patient satisfaction. It leads to less problems down the road, in my opinion, because they're coming off all those medications that have been shown to cause osteoporosis, C. diff colitis at times, kidney problems, and even sometimes heart and brain problems in some smaller studies. The LINX procedure is pretty cool because it is a newer procedure. The Nissen fundoplication is kind of the tried and true. It's been around for 60 years. It's the one that everything is compared to. But the LINX, it's kind of the new kid on the block. And by that, I just mean that it's been around for about 10 years, but we're still finding out, we're still doing data on it. It's definitely a newer procedure than the Nissen. That's what it's being compared to. And the long-term results are pretty good, but it's done the same way laparoscopically. Tiny incision on the belly, we go in and we fix that hiatal hernia. We pull all the stomach back down to the belly where it's supposed to be out of the chest. We close up that diaphragm behind it. It's actually magnetic beads that open and close. So we put in these magnetic beads around the bottom of the esophagus that open and close whenever food comes through it. And that's to simulate the lower esophageal sphincter muscle, or the opening and closing of that sphincter muscle, much as the way your body should before. And it's just these beads that you put around, and the difference is that the Nissen, you kind of have to slowly advance them back to a soft diet over time. The LINX, you actually want them eating every hour while they're awake. The LINX is an outpatient surgery, so they come in day of, they get the LINX, they go home the same day.